The videos of Swot nurse notes serve as worded explanations and for demonstration purposes only. These notes are based on the owner of the channel's understanding. The channel's purpose is to assist with studying and to help with adapting to the UK clinical setting. These notes are short and simple for persons to better have a foundation knowledge to build on. This, however, does not serve as a specific guide to the NMC OSCE and CBT exams. Hey everyone, welcome back to the channel. Today's topic, as stated in the thumbnail, is hand hygiene. Are you confident with performing hand hygiene according to WHO guidelines? Well, if not, you can use this video to assist you. Hand hygiene is one of the most effective methods to prevent the transmission of pathogens. Now let's talk about hand washing. According to World Health Organization guidelines, when performing hand washing, it should be done 40 to 60 seconds. And yes, it is okay to perform it within 40 seconds. If hands, however, are visibly soiled, it is recommended for 60 seconds. For the use of alcohol hand-based gel, it is required to rub hands for 20 to 30 seconds until dry. Feel free to review WHO standard precautions in healthcare. Do you remember the 5 moments of hand hygiene? If yes, leave a comment below stating the 5 moments of hand hygiene. The 5 moments for hand hygiene approach is designed by the World Health Organization as an aim to minimize the risk of transmission of microorganisms between healthcare workers, patients, and the environment. The 5 moments are as follows. 1. Prior to touching a patient. 2. Prior to doing a procedure. 3. Post-procedure or bodily fluid exposure. 4. Post-touching a patient. 5. Post-touching a patient surrounding. I will be using pictures for the first demonstration to show step-by-step the hand washing procedure. Note carefully that for hand hygiene using hand sanitizer gel, the procedure is the same, excluding the use of water, soap, and the use of paper towels to dry hands. Let's begin. First, wet hands with running water. Second, apply ample amount of soap to hands. Third, rub both hands palm to palm. Fourth, place the right palm over the left dorsum of hand with interlaced fingers and vice versa. Note, this is done for both hands. Fifth, place hands palm to palm again, this time with fingers interlaced, rubbing both hands together. Sixth, interlock fingers of both hands. Rub the backs of your fingers to your opposing palms with your fingers interlocked. Seventh, rotational rubbing of fingertips to the palm of hand and vice versa. Eighth, rotational rubbing of thumb and vice versa. Ninth, rotational rubbing of wrist and vice versa. 10th, rinse both hands with running water, then pat dry using disposable paper towel. Use paper towel to turn water tap off, then after place it in a domestic bin. I hope that demonstration 1 was clear and you understand. If not, demonstration 2 should help even more. A video will now be used to show the hand washing procedure. Let's begin. I will now perform hand hygiene according to WHO guidelines. First, I will wet my hands. Then I will apply ample amount of liquid hand soap to my hands and rub my hands palm to palm. Right palm over the left dorsum of hand with interlaced fingers, and vice versa. Rubbing palm to palm with interlaced fingers. Rubbing with fingers interlocked. I am ensuring that the back of my fingers are opposing the palm of my opposite hand. Rotational rubbing of my fingertips in the palm of my opposite hand and vice versa. Rotational rubbing of my thumb and vice versa. Rotational rubbing of my wrist and vice versa. Rinse both hands, then pat dry using paper towel. Correct and thorough hand hygiene is an essential part of infection control. It is effective in breaking the chain of infection, thus reducing the spread of various pathogens. If water tap is not sensor or knee and foot operated, remember to use a disposable paper towel to turn the water tap off. Then dispose of in a domestic waste bin. Remember to manage your time with hand washing during the exams. I hope that this video demonstration was beneficial. Now, let's look at about some OSCE exam tips. For the OSCE exams, perform hand hygiene at the beginning of each station before completing any required task. At the end of completing a station, verbalization of performing hand hygiene can be accepted. Note the marking criteria as to when this should be done. Remember to verbalize step by step what you are doing when performing hand hygiene. Perform hand hygiene prior and post completing a clinical skill. If in doubt on whether or not you should perform hand hygiene during the exam, still perform it anyway to secure your pass. Ensure, however, that you manage your time. Use the 5 moments of hand hygiene as a guide throughout the exam.